My name is Lori Sweevel. I'm a psychologist and the Director of Outpatient Psychiatric Services for St. Lawrence Health System. And we're here to do a presentation on COVID-19 and the impact on children and families. I'd like to introduce my coworker.
Hi, my name is Heather Rich. I'm a licensed social worker and a certified alcohol and drug counselor.
So today we're going to talk about what is normal functioning for children and adolescents, and then also talk about the impact that the pandemic COVID-19 has had on functioning of children and families. So children are developing, obviously, from birth till as adults too, and we look at social, emotional, and behavioral functioning. So typical developmental tasks of children and adolescents for the primary students, they're learning more verbal skills, socialization, and really how to become students, the structure of school. In elementary school, students focus on fairness, social skills, taking turns, waiting, and also focus on academic achievement. In middle school, students really focus, there's a lot of emotional and physical development. They're going through puberty. There's a lot of focus on being the same, dressing alike, liking the same music, and sometimes, we're moving toward differentness. Whereas when they go into high school, students, their thinking changes. They're now thinking abstractly, and they really are focusing on their identity and becoming more independent. Now that's something we all do, or the students all do and continue to do. How the pandemic has affected these tasks as students are home, as there's more social isolation and loneliness, and the structure of their day has changed greatly. They're used to, having math first period and ELA second period, and with the remote school and hybrid, there's a lot of changes in the school curriculum and the school structure. And on top of that, there's also some parental stressors and angst, people losing jobs, and that affects the way children and adolescents also are developing, and that has been affected by the pandemic. So if we focus more kind of on social changes during COVID-19, social functioning is a very, very important part for children and adolescents, and the importance of the peer group for their identity, like who am I? Do I like to play policeman? Do I like to play house? That starts early, but it continues on into adolescence even more so. Do I want to go to college? What do I want to do in college? Do I want to get a job? So that's really important for children and adolescents to talk to one another, develop good social skills, which also just includes basic things: eye contact, taking turns, being fair, being reciprocal. And in addition to that, there's also a lot of support that peers and students get from one another. And that's been more difficult during the pandemic, of course, because people aren't seeing each other. There are other ways to do that, but at least the face-to-face has greatly changed. So losing social links and feeling excluded can lead to more depression, and we're going to talk a little later how some of these changes and the duration of the pandemic has affected mental health and also substance use. I guess on the positive side of things, they have shown that because everybody has had to social distance and everybody has had to be in quarantine at some level at one point or another, that can mitigate some of the feelings of social isolation. And then also with the use of internet and video and connecting, a lot of kids connect through video games and social medias, that's also mitigated the effects. Do you want to?
Sure. So looking at obviously lots of family stressors during this time of COVID, I think most of us have been sort of exposed to having to quarantine as a family, and how much that can add to, some of the stressors and difficulties of how we get through every day. As Lori was saying, parents at time, loss of income due to, losing their jobs and how much that impacts everything, from not having enough food, worried about stable housing, as well as providing clothing for their family. Then with essential workers, again, those people that still have to go to work every day, even through this really stressful and difficult time, how that brings the worry of, them themselves, are they being exposed to COVID and possibly bringing that home? So the added stress that brings. And then I think, again, remote learning has been quite the difficulty for everybody, and how that works, from the schools and what they're doing to be able to provide that, as well as the family at home and the children that are having to learn how to do schooling in a totally different way, and how much that brings added stress for everybody. So some of the complex challenges that are related to this, obviously, mental health, seeing the changes in anxiety and depression that it has brought for many people. I would say both adults, adolescents, and children. Substance use disorder, how that has changed throughout the pandemic. I'm seeing some increases in use there. How it makes it very difficult, especially for children, is being, in a home where there is domestic violence. And so where school may have one time been their safe haven, now that they're home in an environment with domestic violence, how much that is changing things for them, as well as child maltreatment, the same thing of having a safe haven at school, but now maybe being more exposed to that maltreatment being at home. So just some data for St. Lawrence County, that there's approximately 300 children in DSS care right now, and that they have seen an increase in CPS calls related to maltreatment and education concerns, mostly because, again, kids aren't in school, so they're not having as much contact and access to them. So, reaching out to try and get support for them in the best ways that they can. So looking specifically at the impact of substance use on youth functioning, sort of looking at, 4 different areas of concern to look for signs and symptoms. So this could be like a shift in their mood or personality. And I think with this, it's very typical to think, it may be just a plain sort of moody teenager. It may be, what you think normally of them. Also, I think a lot of times with substance use, it may mimic also some mental health, symptoms or concerns. So I think the biggest thing with this is making sure to kind of understand kind of where your child's baseline is at, right? And so knowing sort of as best you can, their baseline, moods and behaviors and their activities, so that you can better see when that starts to shift or change, to notice, if there's a concern with substance use. So with a shift in mood or personality, this could be, maybe they're more sullen or sad, maybe less motivated. It could be other things like, being really silent, not communicating at all, unable to focus. So different things that just change for them there. So behavioral changes could be, changes in relationships with family members or best friends, like they're changing up their friend groups. Maybe absenteeism, from school, even though if they're remote learning, maybe they're never getting on to do any of their classes. Avoids eye contact, is really isolated in their rooms, like locking their doors so that, nobody can get in and see them or check on them. This also could be, going out all the time. Maybe they're never home and they're missing curfew or, just not respecting the rules of the household. Maybe secretive with their phones, making lots of excuses. So could definitely be some behavioral changes that are different from their baseline. When it comes to hygiene and appearance, are they, smelling of, let's say, smoke or something like that? Do you smell it on their breath? Do you smell it on their clothes? Are they messier than usual? It's just their hygiene in general changed to what it typically is. And then physical health. Are they sick more often? Are they unusually tired or lethargic? Maybe are they having nosebleeds or like a runny nose all the time? Any sort of like sores that don't make sense, sweaty or cold shaking hands. And then sometimes even to the, biggest part of like, are they perspiring a lot? Even having like vomiting or seizures that don't make sense. So again, really major physical health, that's really truly away from their baseline. So most commonly used drugs right now, it's kind of interesting for the year of 2020. It's the National Institute of Health, typically does in collaboration with the University of Michigan. They do a big, national study to kind of look at the different substances that kids are using from 8th grade up to 12th grade. And so unfortunately for 2020, they start in February. They were only able to go to March, and then had to shut the study down due to COVID. But within that time frame for 2020, what they found, again, it's not specific to grade or age, but just as a whole, that vaping nicotine, vaping marijuana, marijuana in general, alcohol and illicit drugs tended to be the top drugs that were being utilized from 8th grade to 12th grade. Now, this can be very different, based on the area that you're in, the age group of the child, but this is, again, as a whole of what they came up with the most used drugs currently for 2020. So what parents can look for in their children, like if you are having concerns that your child is using, I think, again, noticing those changes from their baseline, right, is to use your nose. When you're having, your child, let's say, comes late back from curfew, right, is to have a face-to-face conversation with them. Are you smelling alcohol in their breath, let's say? Are you smelling smoke, and their clothing, on their breath, that sort of thing? Or even, are you smelling like an excessive amount of like mouthwash or something minty to try and cover up, some sort of smell? Definitely to look into their eyes. Do you see, are there, pupils, are they really, really a pinpoint, or are they, really dilated? Because that could mean a different type of substance. Flushed cheeks or face, do they have really, really, really red cheeks or something like that? To watch out for, as we kind of talked before, watch for behavior and moods. Are they really maybe upset about something, having an overreaction to, being called out on coming back late from curfew. I would also say too, like, are they really clumsy? Are they kind of not able to stand or walk in a straight line, or, kind of clumsy in their movements, let's say go into the room or something. And then I would say too, if you have concerns, children may not like this, but to search their spaces, right? To be looking for things, in their room, to be looking through backpacks, or, to be looking through dressers, closets, whatever it may be, if you have a concern that there's some use and they're not tending to be honest about that.
So the impact on mental health and emotional functioning throughout the pandemic, there's been an increase in depression, anxiety, and post-traumatic stress disorder. Symptoms of depression, there's the mood, which is sad, but there can also be changes in appetite, eating too much, eating too little, changes in sleep, sleeping too much, sleeping too little, feeling tired even when sleeping, loss of interest in activities, helplessness, feelings, hopeless, worthless, suicidal ideations. So those are all things to look for, I guess, not only during the pandemic, but they have, these symptoms have increased for kids during the pandemic. Symptoms of anxiety are kind of nervousness and just unsure, avoiding certain things, asking a lot of questions. There can be physical symptoms, they feel like their heart is beating faster, they feel sweatier, and just general worry, worrying about lots of different things. It can be related to the pandemic. Mom or dad, if you go to work, I'm worried you're going to get it and you're going to die, or you're going to bring it home. Or if I go to school, I might get it and I might bring it home and then I'll make you sick. So there's a lot of worries about that and the what ifs. And then post-traumatic stress disorder, just how children interpret changes can be traumatic for them. Some of them have lost a loved one to COVID, or haven't been able to see relatives that are certainly very important to them, or family members because of travel restrictions. Just loss of relationships has been a big one. So, and the other thing, as far as the pandemic, that the duration of the isolation versus the intensity, and still the duration is continuing, and that's really affected loneliness. I think what we were seeing at the beginning of the pandemic is that some of the kids that were already in treatment with us were kind of happy, like, oh, I'm home from school and this is great and I can use social media. And I think over time, it's been so long and they don't know when it's going to end, and things at school has changed and just different things have changed, that the duration has really increased the symptoms of mental health. People can't predict what's going to happen. Parents can assure them, oh, it'll all be over within a couple of months, because it's just, there's so many unknowns. So I think the duration has really, really affected the effects of depression and anxiety. And overall, what's been reported in general has been in more depression in girls and more anxiety in boys. I thought that was interesting. So they actually have done some preliminary findings in China and also in England, and it's from 13 to 18-year-old, just increase in anxiety, clinginess, not wanting to leave loved ones for fear of what might happen if they do, being more distracted, fear of asking questions about the pandemic. So I think some people, they have a lot of questions, but asking the questions is also fearful because people don't know parents don't know the responses, or some of the responses that they're getting are just very worrisome. And irritability. I think oftentimes when kids and adolescents are worried or are depressed, that it comes out more as irritability or anger. And I think sometimes that's a big difference from adults, that sometimes irritability might be interpreted as more oppositional, or they're just being angry. But a lot of times underneath that, there's worry about something or sadness, and they don't have the verbal skills to express it the way adults do. And in England, they did a study, and younger children worried more than the older children. Again, I think that's related to verbal skills and able to say how you're feeling and express it in a way that's more logical, because developmentally, cognitively, older children are able to understand more and able to verbalize that more. So again, other behavioral changes that have increased during the pandemic, difficulty concentrating. I think kids and adolescents, children and adolescents have a lot on their mind. So when your mind is being filled up with, I wonder if we're going to have food on the table, or geez, mom or dad have been working 16 hours. I don't know when they're going to be home. That affects concentration. Boredom. A lot of children and adolescents have been confined to their homes, and some of them, a lot of them do have really good activities and are able to manage their leisure time. But again, the duration of the pandemic, after a while, I think they've expressed a lot of boredom and kind of being sick of being in their room. Irritability, I talked about before, but I also think just irritability of, I want to go skateboarding with my friends. Why can't I go skateboarding with my friends? Or why can't I have a birthday party? There's a lot of reasons why kids and adolescents are irritable. Adults as well. Restlessness, again, confined to, an enclosed area. I think, it's easy to get restless. I think also remote learning. Students have voiced a lot of restlessness. It's harder to pay attention and stay still in your seat and all those things that we typically do at school when it's over a computer screen. And it's also easy to, to be restless, and there might be something next to your computer that's more interesting, like anything to fidget with, or just it's distractibility and the restlessness. Nervousness, fear of the unknown, not sure what school's expecting, not sure really how they're doing at school. And then I think there's also a sense of shared nervousness with parents and with adults too. When adults are nervous about things, kids pick up on that. And if it's not really talked about, kids can interpret it or perceive it in a way that may be very different than the adult, but it's still that kind of what if, or I'm not sure, and that creates a lot of distress. Loneliness, again, a big part of school is emotional connectedness, social connectedness, and that has been disrupted greatly since March of last year. So I think there's been an increase of loneliness. Uneasiness, when is it going to end? Is my family going to get it? Just not knowing, just those, and that goes along with the worries as well.
Mm-hmm. And I just kind of like to add to this, in all of these things that are behavioral changes, this is a possibility where substance use can come into play, right? As, kids maybe before had used a little bit of, marijuana and felt better, they may now, in experiencing all of these behavioral changes and all of these struggles, may say, hey, it helped last time, will it help now? Right. And so to kind of manage some of these feelings, even though it's not in the healthiest way possible, this may be a place where they start to kind of self-medicate, with drugs or alcohol. So definitely a place to pay attention to how these things may be changing and how substances can come into play there.
And just, I think also with substance use and with these behavioral changes, I think symptoms that children and adolescents are showing are exacerbated by parental stress. So we work a lot when we see children and adolescents with coping skills, not only with the children, but also with the parents, because parental stress, I mentioned it earlier, does kind of trickle down onto the children and adolescents. So, and a change of structure, I think that's really understated of how that's affected some of the symptoms that children and adolescents are demonstrating, because they are so used to a school day where they know what time they need to get up, they know what time they'll be home. In between, things are pretty well structured, and now they're in charge of their own structure, and that's just difficult when they're home and they don't have access to other things that might help them with their daily structure. So just some local data, talked with some St. Lawrence County schools. After the holidays, 16 out of the 18 schools did reopen, but it changes day to day. And I'm not sure today how many schools are open, but I think they're doing their best to stay open, knowing the importance, not only on education, but the social and emotional and behavioral effects. So I do think right now it is day to day, and when they are going fully remote, they try to keep it as short, but as safely as possible as well. I think they're doing a fantastic job. Other things that have been concerning and stressful for the schools, the state education department has mandated a lot of rules and regulations, and those have changed over the course of the pandemic as far as remaining open and COVID testing. And if we're in a yellow zone, certain percentage of students have to be tested. If we're not able to, then they have to go fully remote. So there's a lot that goes into play for the schools to remain open. They've changed their curriculum and structure over the course of the pandemic to address the changing dynamics. And I think they've really gotten a lot better of what's going to be best for the students. And I think they're trying their hardest in doing as much as they can to meet those emotional and social needs and the structure. Again, it's different. And if you talk to any teacher, they're saying, oh my gosh, I can't wait till school opens again. So I think, there's just so many things that are changing that to go into the next one, how do we prepare students to return to school and what's going to come? So now this is kind of what's going on. When students return to school, it's not going to be as it was pre-COVID. So how to reintegrate not only the curriculum, but also the behavioral expectations, the emotional expectations, the structure. There's just going to be a lot of changes for the teachers and for the students and for the parents, I think, for everyone involved. So in particular, I also talked with the superintendent of Ogdensburg School, Kevin Kendall, and the assistant superintendent, Jackie Kelly, about over the course of the pandemic, what they've seen. And initially, remote students, especially elementary, were in the single digits. It was a little bit higher into the teens for the middle high school. But now it's up to 50% remote students. And I do believe it's been with the uptick of cases and just parents becoming more and more concerned about COVID. So more and more students are remote. The biggest obstacle is the accessibility of students and difficulty remaining in touch with some of the students. And their concern has been some of the students that aren't accessible are the ones they're most concerned about. Hence, I do think, Child Protective Services has had to be called just because of concern for safety for the students. In elementary, they're finding the students who need services the most, more special education interventions, are remote. Again, it's not right or wrong, but that's just what's happening right now. So I think it's made it more difficult and challenging to reach those students educationally. And what I talked about before, concerns of anxiety and behaviors when the students return, like how are the students going to return? I asked them specifically about, have they seen an increase in mental health concerns or substance use concerns? And both of them consistently was like, we don't really know. We don't really know what's happening because of the remote, the interactions they're trying. Counselors do reach out, but they're believing when students return, they probably are going to see more mental health concerns and more substance use concerns. So I think they're on top of it, but right now it's very hard to determine exactly, what is happening. We already talked about structure and social interactions. I do want to touch upon a small percentage of students are doing better. And those are the students that pre-COVID had a lot of social anxiety and found it difficult to attend school. So remote school for them, actually they're doing better. However, at some point they will return to school and there's a concern about their social anxiety. It's almost been reinforced since they've been remote. So how they're going to reintegrate back to school. So, parents do contact the school mainly about necessities, not so much about the education, but they, where can they find food, clothing, if they need transportation. That's been a challenge. And what I think the schools and where we've been talking about, I think there's going to be a need for regional training for trauma sensitivity, moods, and what to look for in students as far as substance use and mental health when they return. So, absolutely. So, frequently asked questions. How do I know if my child has mental health concerns? I think what Heather had said earlier for SUD is also for mental health. So if you know how your child is baseline, what their baseline is, what their functioning is, and you see changes, then I think it's worth asking and looking into. So I think being supportive, but being direct, sharing your observations. I noticed that when you went into the room, you threw your book bag across the room, what's going on with that? Or I'm really concerned that you've been in your room for 12 hours and you haven't come out at all. That's a little bit different what's going on. So any changes in mood, social interactions, their functioning, behaviors, I think it's worth being supportive. I noticed, there's some changes. I'm concerned about you. Can you, what's going on? I think is very important. And then talk to others. Oftentimes others will notice a change, or sometimes the child confides in other peers or even teachers or just other people other than their parents. That's pretty normal developmentally. But if you have a concern, I think it's very important to ask. And then I think a really important and scary topic sometimes to talk about is, how do I know if my child has thoughts or plans of suicide? So some warning signs, again, noticeable changes, eating and sleeping, changes in behavior or personality, withdrawing, isolating, not talking, more agitated, kind of oppositional, distressed or panicky, talking or writing about suicide, even if it's joking, I'm just joking, is definitely a warning sign. Giving away things, saying goodbyes, dropping grades at school, those are warning signs. Again, if there's any concern, it's very important to ask directly about suicide. I know sometimes parents and adults and a lot of people are afraid to say, do you have any thoughts about killing yourself? Do you have any thoughts about, ending your life? But it's really important to ask directly. Have you ever thought about how you would do it? The guns or pills and have you ever thought when you might do it? The one thing with adolescents, which is different from adults with suicide, is oftentimes they don't plan it, and their period of distress is kind of impulsive. So they might have a period of a half an hour where they're like, I can't take it anymore, I'm going to kill myself. If they have access to a lethal means, they might act on it. When they get through it, they're usually okay. It's an impulsive act. It's not like they're planning it. So it is really important, if there's any concerns, to act quickly, supervise them, make sure they're safe. There's Reach Out, which is a 24/7 crisis line, which we have the number 265-2422, or call 911, go to the emergency room, but definitely seek help if there's any concerns of safety.
So kind of changing again, looking at, as a parent, how do I know if my child has a substance use problem or they're just experimenting, which I think, again, is a really tough question to ask and a tough question to determine, specifically because, for most adolescents, they do go through a period of experimentation, with drugs and alcohol. And so, some things to pay attention to is kind of like their frequency of use. Right? Are you noticing that, I don't know, maybe at one time they came home, smelling like alcohol, but now is it something that you're noticing that this is happening more regularly, right? Are you starting to notice maybe that you have concerns, like, are they using before school every day? Or are they using, immediately when they get home from school every day, right? So just noticing that, concerns that they are using more often, right? Again, some very common factors that we've talked about in both substance use and mental health, right, is how much is it impacting the things that they do every day, right? Are they now, no longer going to school? Is it a fight for them to go to school? Are they not logging on to their online classes at all? Because this may be because, they don't feel good from using, or they'd rather use, right, than go to school. Same thing with, sort of social and family. Have their friend groups dramatically changed? Do they no longer want to spend time with family where once they did? Or is it constant conflict, right, within those friend groups or within, family members? And so sort of the same thing with emotional functioning, where they used to be able to say, they could work through something if there was a conflict, now becomes where they're extremely angry. And it's just sort of fighting and arguing all the time, or sort of on the reverse side, they could be very, very sad or isolated, or, just kind of keeping all those emotions inside to themselves. So also some negative changes in behavior that could possibly be a sign of a substance use problem. Are they constantly breaking curfew, because they are out using with their friends and would rather be doing that than come home? Are they starting to steal? Sometimes this may be where you're noticing money might be missing out of your wallet, or they could be stealing other things from the house, to kind of, as it says there, to sell belongings. Are they selling, I don't know, is the laptop all of a sudden missing, right? Because they may have sold that in order to be able to purchase something. And so lying, or excuses. Are they constantly trying to, get out of things or make excuses, or are you finding them just lying in general? On a continual basis? Because again, being adolescents, it's a hard thing to determine. And so if there are, true questions or concerns about somebody using, the same thing would be to seek out help. Because there is, for a diagnosis of a substance use disorder, there's 11 criteria, and they only have to meet 2 of those criteria to be able to, say that they are struggling in this area, and would be able to provide counseling and support for that teenager. So again, just kind of to know if your child is using, I think again, as parents, this can be a difficult thing to want to address, but not to be afraid to just ask them directly, right? As kind of going back to saying that, vaping marijuana or just vaping nicotine, marijuana use, alcohol, illicit drugs, to be able to ask them, if this is something that they've come into contact with, or if it's something that they've used, and being prepared for that answer. I think as parents, we don't want our children to be using, but this is a real thing that could happen. And so being open and able to have that conversation, so that they know that they can come to you and not just, get an answer that doesn't help them, as they may have questions about what they have been exposed to. Kind of like we were saying before, get close and smell, see if you smell anything on them, alcohol, smoke, that sort of thing. looking them again into their eyes and seeing just, are they really bloodshot? Are their pupils, not in a way really constricted or really dilated, to watch their behavior in general, and to search their spaces if you have concerns. I think too, another place that this has probably increased, because, kids are home so much more now, is they're just online so much more, right? So whether they're watching TV, they're watching movies more, they're on all the social media stuff, right? How much is drugs and alcohol on there? Quite often in, movies or, TV specifically, a lot of times use is very glamorized, right? And so it looks cool, but it doesn't, really show the true impact that it has, right, on a person or on a family. So I think it's really important, again, at this adolescent age, is to be having some of those direct conversations, asking some of those direct questions, because that way, it really does foster the openness for a child to come and be able to ask questions, rather than think, I'm going to come and ask, or come and say, oh my gosh, I tried marijuana for the first time, and get in trouble. So I think, again, promoting and asking questions and having conversations is really big, to support them, and to also know whether or not they need some extra help. Okay. So how do I get help for my child? So sort of overcoming some, barriers to treatment. I think, again, stigma is a huge one. A lot of people, again, want to shy away from admitting that they are struggling, whether it be with mental health or it be with substance use. But knowing, sort of breaching that stigma is really important, to be able to ask for help, and be able to start to engage in treatment services. So access to services, both local and online. We do have, kind of at the end of this, quite a few resources that are available here in the community, which I think, again, right now, everybody is doing a really great job of being able to provide services, both in person and online. So it's definitely a combination of things, but also can be, barriers sometimes of, people may not have transportation to be able to get there. Again, the stigma may get in the way, and so I think sometimes too, time, do you have time to be able to, whether it be transport your child to an appointment, because you might have to miss work to bring them in, but hopefully that's where maybe some online stuff has been able to breach some of those barriers. So we talked about transportation, and then also financial, worried about, as we talked about earlier in the, training, of sort of how people are not having all the money that they need to provide food or housing or clothing. And so, worried about this being another thing that they would have to pay for. But again, knowing that, again, financial should never be a reason not to seek treatment, because that is something that we can work with, any family that comes in. So school services, I think, again, as Lori was talking about earlier, how much kids aren't in school, it's hard for the counselors to have as much access as they probably would like to the students, and how that is providing just difficulty for them, but knowing that the school is there to provide services and support for anybody that is looking for it. And then community resources. We have many clinics throughout the county that provide services. And so, again, being able to come in usually is the start of it, but then oftentimes at most of those clinics, they're very good at connecting them with other, services that they may need, connecting them with other supports within the community. So in some ways, coming in to start services is just step one. And then there's other providers in the community to be able to get them connected with. So like such things as the child and family support teams, mobile integration team, again, great supports within our community that are available for everybody.
I just wanted to add one thing to the stigma, because I think it's oftentimes difficult for children to kind of understand and seek help, but sometimes it's hard for the parents, and I think the children pick up on the parents' hesitancy. So I think having a discussion that, it's good to get help. If there's a problem, any kind of problem, if I have a medical problem, I go to a doctor. If I have, some emotional problems or emotional difficulties, then it's good to talk to somebody. So to kind of really say it's a good thing to get help. And I think working with the families, as a whole, that really helps that. So our resources at St. Lawrence Health System, we have a broad array of behavioral health services. So we do have an emotional support line, and that is a 24/7 support line, and that is it's manned or covered by therapists, by social workers and psychologists, and we have had an increase of calls. Not so many children. I think we have had some, but mainly adults. But anyone can call, and we listen and try to provide support and connect if people aren't connected yet. And we do have our psychiatry clinics. We have 2 in Potsdam, and we have 1 in Gouverneur, and providing outpatient mental health, behavioral health services with psychiatrists and therapists. And then we have our outpatient substance use disorder clinics, also in Potsdam and Gouverneur, and they provide outpatient services, again, with medication assisted treatment, counseling groups. And then we have inpatient services. We have a rehab service in Potsdam, and that's residential, typically up to 28, 30 days. And then our Gouverneur Detox, which is a short-term detox program to help medically help patients get off substances safely. So
I don't know.
Okay, so local youth resources, and right now I reached out, and they are definitely online right now, I think because of COVID. So that's, I still think are good resources. They typically do groups for teens. Most of these are mainly for teens, not so much the younger students, younger patients, but the St. Lawrence Health Initiative it's called the CAP program, and I think it's a little misleading. They do have the Teens Help, but that is a group online right now that helps teens address issues with sexuality, gender, making good choices, healthy choices related to sexual relationships. And I think, that's something teens are working on is they're coming into their identity and relationships. The HIDE online group is a group that helps older teenagers work toward becoming adults and learning the skills. So budgeting and finding transportation, helping find jobs. So that's another good resource for teenagers that want to become more independent, with some support from peers and from adults as well. The Northern Regional Center for Independent Living, NERCL, also has some online teen groups, and I didn't list them, but we listed the website, so they would, it's again for teen support on socialization. I think sometimes they've had some with how to help teens with remote learning, just support with the differences in social isolation. And then the Seaway Valley Prevention Council is more of a prevention for substance use, and they have a teen intervene program, and they will meet, this is individual, actually meet with the teen and the parent, and they'll do some assessments and determine if there is a substance use disorder issue and what the appropriate level of intervention is. It can be a brief intervention. They can meet with them, 2-3 times. If they need more ongoing substance use intervention, they would refer to a program, to a clinic, to a service.
So these are some more, national hotlines that are out there, again, available 24/7, able to contact them at any time. So you have the National Suicide Hotline, you have the Teen Line providing emotional support for youth. And then the SAMHSA National Helpline, they actually provide a couple different things in regard to mental health. They also are putting in something specific, sort of like a disaster, related to COVID-19 as another place for people to call in and be provided for emotional support in regard to that as well. Actually, the disaster distress helpline, that's the SAMHSA one there as well. And I think too, there's lots of great, truly online. So the Youth Alliance, they provide a long list of all kinds of things, looking at emotional, struggles, substance use. There's things related to eating disorders, body image, things like that. They have a huge list of supports that they provide there, both via the phone and online. So they're a great resource to use. And then the Tribe is an online therapy. So it's a great website, and they have things driven there specifically for adolescents, like a peer-to-peer help there. And sometimes with adolescents, having it be peer-to-peer is what helps the most, versus an adult trying to, say, let me help you, or, why don't we try these things? Definitely adolescents with their development, having it be peer-to-peer is oftentimes more effective.
Yeah, and then there's also apps. A lot of children and their parents and adolescents are downloading apps on their phones that can be very helpful. Some have as simple as sleep hygiene, tips to get to sleep easier, mindfulness, meditating. So there's a lot of different apps. We put up a resource for that, the 25 best mental health apps. And those actually people have found very, very useful. And then there's also cognitive behavioral therapy, CBT, self-help groups online for teens. And these are really helpful for learning coping skills. So how do our thoughts affect the way we feel and the way we behave? They have Mood Gym, the Sparks, the Think, Feel, Do, and really focusing on if a lot of times if children and adolescents do have these negative thoughts, like I can't do it, nobody likes me, why should I even try? Cognitive behavioral interventions dispute some of those thoughts and replace, and you learn more positive thoughts to address, which definitely improves mood and improves behaviors. So those can be very helpful as well. That's the end of our presentation. If people do have questions, they can always feel free to contact us. We are at the 315-261-5420 and 315-261-5405, the mental health clinics. Be happy to answer people's questions. We accept referrals from providers, but also we accept self-referrals as well. So thank you, everyone.